Hello, everyone, and welcome to our question lab this evening. As you may be aware, tonight is a very special question lab. Although the topic is psychiatry, tonight is going to be and is our 1-year anniversary of doing these question labs. Leading tonight's discussion on the topic of psychiatry is Dr. Vakharia, and Paris is going to introduce himself now. Paris.
Thank you, Sean. Hey guys, my name is Paris. I'm a dermatology resident at UT Southwestern in Dallas, Texas. I originally went to pharmacy school in St. Louis, Missouri, and then went back home to Michigan to do medical school. And I'm also working with USMLE-Rx as an RX coach. So I work one-on-one with students to help prepare them for the USMLE Step 1 as well as Step 2 CK. And I'm happy to help lead tonight's session.
So without any further ado, let's go ahead and get into our first question of the evening. You can see that the answer choices are covered up. That is by design. That's because we do not want the answer choices to guide or dictate your thought process. And we certainly don't want you to see an answer choice that you're unfamiliar with, which may cause you to panic as you're trying to answer the question on test day. Once we cover up the answer choices, we will begin by reading the lead-in. The lead-in is the last sentence or the question itself. So let's do that now. Which of the following medications is this patient most likely taking for his schizophrenia? Which of the following medications is this patient most likely taking for his schizophrenia? The reason why we read the lead-in first is because we want you to know what the test writer is asking so that when you read the vignette, you can pick up on all of those relevant clues without having to reread that question and waste valuable time. Once we read the lead-in, we'd like to ask our audience and our students, how many steps do you think this question will require? An example of a one-step question could be where you're asked for the diagnosis. An example of a two-step question could be where you're asked for the treatment for a diagnosis. And an example of a three-step question could be where you're asked for the mechanism of action for a treatment for a diagnosis. So I'll give all of you a few moments to respond in the question box and let us know how many steps you believe this question will require. And while that happens, I know we have a lot of people that just joined, so I want to remind you that we do have a very special raffle today. It is our 1-year anniversary of Question Lab, so we have 4 winners this evening, and you must be present to win, so make sure you stick around. 3 winners will win 6 months access to RX 360 Plus, and the grand prize winner will win 12 months of access to RX 360 Plus, as well as 3 RX coaching sessions absolutely free, okay? I see the responses coming in, so let's go ahead and read that vignette. A 29-year-old man comes to the clinic for a follow-up visit. He has been undergoing treatment for schizophrenia for 5 months and states that he is compliant with his medication. He reports some swelling in his breasts, which are tender to palpation. He has not changed anything in his lifestyle. His temperature is 37.1 Celsius or 98.8 Fahrenheit. Pulse is 90 per minute. Respiration rate is 14. Blood pressure is 126/84. And oxygen saturation is 99% on room air. The exam shows enlarged breasts. The serum prolactin level is 80. A brain MRI is normal. Which of the following medications is this patient most likely taking for his schizophrenia? I want all of you to start thinking about the relevant clues in this vignette as I hand it off to Paris.
Thank you, Sean. So we're going to go ahead and show you what we think are the important clues in this vignette in the lead-in. And starting off, demographics is usually the first thing that you're going to get, and it's always important to take note of that and highlight that. The age is really going to give you a clue in what you should be thinking, what things you can maybe start to rule out, and then the gender as well. They also give us some more information about his background medical history, some social history about compliance with his medication, and then they tell us about really the main reason why he's coming in, and that's these enlarged breasts, swelling of the breasts. They give us some lab findings, some imaging findings, and those are always important to take note of, highlight, because that's often going to be relevant to the specific lead-in question. And that's kind of what we did here as well. So in this lead-in question, specifically, the most important things are medication most likely taking for schizophrenia. So how many steps is this question? Well, I think we kind of have to work backwards a little bit here. So one, we kind of need to figure out what's going on with this patient. what situation is developing, and then 2, based off that, maybe what drug could be causing that. And depending on the answer choices, maybe there could be a 3rd step involving the mechanism of how something could go about. So this could maybe be a 3-step question, but I think probably a 2-step question. 1, what's going on with this patient, and 2, maybe which medication could have led to that. So let's take a look at those answer choices. And so as you can see, we have 5 answer choices here. And what we're going to do is we're actually going to work through them from the bottom and work our way up to the top. And the reason we recommend doing this is because a lot of times we'll see students, they'll start at the top, they'll see something they like, and then they'll go ahead and select it. And then a lot of times they may get that question wrong because they never got through all the answer choices. So we recommend working from the bottom to the top. This way you won't bias yourself and you'll make sure you'll get through all the answer choices. So we'll go ahead and do that now. Answer choice E, ziprasidone. D, risperidone. C, olanzapine. B, metoclopramide. A, clozapine. So we're going to go ahead and open up that poll. Go ahead and select the medication you think this patient is most likely taking for his schizophrenia, and we'll talk about it in just a few seconds.
Excellent. Thank you so much, Paras. I see a lot of people in the question box. Instead of letting us know how many steps the question will require, jumping to an answer. Remember, this is not a race. Test-taking skills require discipline and require a routine and require a process that you're going to employ to help minimize errors on test day. So try not to jump ahead and try to follow the system. A lot of people have succeeded as a result, and I trust that you will too. So we'll give all of you a few moments here to respond, and then we'll go over the correct and incorrect answer choices. Generally speaking, we're going to wait until about 2/3 of you have responded for every question. All right, let's take a look. It looks like there's already a clear favorite. Looks like 65% of you selected D, risperidone. So let's see what the correct answer is. And the correct answer is, in fact, D, risperidone. So great job, everyone. We're off to a wonderful start. I'm going to hand it off to Paras so he can ensure that we got it right for the right reason and also explain why the incorrect answers are, in fact, incorrect. Paras.
Great, thank you, Sean. Great job, guys. So way to start off tonight's session. So looking at this question, we see that this patient is undergoing treatment for schizophrenia, and we know that he's been compliant, so he is taking this medication. He's also developed what we call gynecomastia, as well as hyperprolactinemia, or elevated prolactin levels. In men, hyperprolactinemia can present with gynecomastia, decreased libido, and sometimes also galactorrhea, where you actually have discharge from the nipples. So there are certain causes of hyperprolactinemia, which include pituitary adenoma, hypothyroidism, and medications. Now we know he had a normal brain MRI, so pituitary adenoma probably less likely. And we do also know that he is on schizophrenia medication. And there are certain neuroleptic agents that can cause this. For example, risperidone works to antagonize the dopamine receptors in the brain, and it prevents the normal inhibition of prolactin release. So you're preventing the inhibition of prolactin release, and thus can cause hyperprolactinemia, okay? Now, the therapeutic effects and adverse effects of these antipsychotics stem from blockade of certain pathways, and we'll talk about that in just a second. So on the next slide, we've actually gone ahead and pulled up some of those various pathways involved in the use of antipsychotics. And you can see there that blockade of dopamine receptors in the nigrostriatal pathway results in some of those extrapyramidal symptoms, while blockage in the tuberoinfundibular pathway results in elevated prolactin, okay? And usually it's the typical antipsychotics like haloperidol, fluphenazine, and it's rarely atypical antipsychotics. That being said, there are one or two that you do need to watch out for, the atypical antipsychotics that can lead to increased prolactin. Specifically, risperidone is most common among those atypical antipsychotics. So let's take a look at the next slide, actually. Sean has gone ahead and pulled up a table looking at drug reactions, specifically hyperprolactinemia. You can see there usually it is typical antipsychotics, but you do also need to keep in mind atypical antipsychotics and risperidone, okay? So you can see there specifically of the atypical antipsychotics, risperidone is one you need to keep in your mind that can cause hyperprolactinemia and thus eventually gynecomastia. So let's go back to the other answer choices, see why those may not be as good answer choices. So answer choice E, ziprasidone, that is also an atypical antipsychotic. The most common adverse effect seen with this is QT prolongation. Does not usually cause the side effects that we just talked about. Answer choice C, the same thing with olanzapine, also an atypical antipsychotic. Doesn't really cause the side effects that we've talked about here, hyperprolactinemia and gynecomastia or galactorrhea. The side effects you should be on the lookout for include weight gain and lipid changes, okay, dyslipidemia. Answer choice B, metoclopramide. Now, metoclopramide can cause symptoms similar to what this patient has experienced, but it's not used for schizophrenia, okay? So that's the key differentiating factor, is that this would not be this patient would most likely not be taking this for treatment of schizophrenia. Answer choice A, clozapine. This is also an atypical antipsychotic, but again, not usually causing the side effects that this patient is experiencing. Side effects you should be on the lookout for with clozapine include weight gain, lipid changes, orthostatic hypotension, and also notably agranulocytosis. So hopefully walking through this today helped explain this answer choice. Great job on this question. I'll pass it back to you, Sean.
Excellent. Great job, everyone. We're off to a wonderful start. Great job, Paras. As always, that was a wonderful explanation. Let's go ahead and move into our second question of the evening. For those of you just joining us, you can see that the answer choices are covered up. That is by design. We do that to make sure that the answer choices do not guide or dictate your thought process, and also so that you don't see an answer choice that you are unfamiliar with, which may cause you to panic as you're trying to answer the question. Once we cover up the answer choices, we begin by reading the lead-in. This is a longer lead-in than normal, so I will read it slowly, and we'll read it twice. The reason we read the lead-in first is because we want you to know what the test writer is asking before you read the vignette. This way you can pick up on all those relevant clues and prevent yourself from having to waste time and reread that question on test day. So here we go with the lead-in. In the setting of the increased saliva flow rate in this patient, which of the following substances will show a decreased salivary concentration compared with the findings before taking clozapine? In the setting of increased saliva flow rate in this patient, which of the following substances will show a decreased salivary concentration compared with the findings before taking clozapine? So I'll give all of you a few seconds here to let us know in the question box how many steps you believe this question will require, and then we'll read the vignette. I see the responses coming in. So let's go ahead and read that vignette. A 25-year-old man with refractory schizophrenia begins taking clozapine. At a 1-month follow-up visit, his serum clozapine is at a therapeutic level, but he says he has pain in both of his cheeks right in front of his ears, as well as pain when he swallows. On further questioning, he also says he has produced more saliva lately than usual. On examination, he is found to be afebrile. In the setting of the increased saliva flow rate in this patient, which of the following substances will show a decreased salivary concentration compared with the findings before taking clozapine? So we'll give all of you a few seconds here to start thinking about the important clues in this vignette as I hand it off to Paras.
Thank you, Sean. So once again, we'll go ahead and show you what we think are the important clues in this vignette and the lead-in. So again, demographics. This is a 25-year-old man who also has schizophrenia, and they tell us that he's taking clozapine. It's also important to note, whenever they tell you about a drug Always important to note, like the last question, are they compliant with it? Have they not been taking it? Is it at a therapeutic level or a high level, a low level? Always important to make note of that. They also tell us that he's experiencing certain symptoms, specifically this pain that he's describing, and that he's making more saliva. So obviously important to highlight that. Then you can see there that that lead-in, it's a pretty lengthy lead-in, and there's going to be a few important things there to make sure that we understand exactly what this question is asking us. So, in the setting of increased saliva flow rate, which substance will show a decreased salivary concentration compared with before taking clozapine? So, once again, in the setting of increased saliva flow rate, which substance will show a decreased concentration within the saliva when you compare it to the patient before taking clozapine? So hopefully you guys are able to wrap your head around that, and that's why it's important to highlight and make note of all those important things in the lead-in. So let's take a look at those answer choices. And once again, we are going to start at the bottom and work our way up. And so hopefully you can see that there's a little bit of a theme with these answer choices in regards to what that substance is that they're talking about. So we've got a few electrolytes here and some other substances. Let's take a look. Answer choice E, sodium, D, potassium, C, chloride, B, bicarbonate, and A, amylase. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the right answer, and we will talk about it in just a few seconds. And I'll go ahead and read that question one more time, just in case. So in the setting of the increased saliva flow rate in this patient, which of the following will show a decreased salivary concentration compared with the findings before taking clozapine?
Excellent. Thank you, Paris. Yes, the question was the lead-in was a little long, so it got truncated. And so I'm glad Paris read that again to you. So we'll give all of you a few more seconds here to respond and select the correct answer. And for good measure, I'll go ahead and read that lead-in one more time. In the setting of the increased saliva flow rate in this patient, which of the following substances will show a decreased salivary concentration compared with the findings before taking clozapine? I see the responses coming in. We'll give all of you a few more seconds here. And then as always, we will go over the correct and incorrect answer choices. All right, let's take a look. It looks like it was pretty close. 25% of you selected amylase and 23% of you selected bicarb. So let's take a look and see what the correct answer is. And the correct answer is D, potassium, and 19% of you got it right. So a challenging question indeed. And you will have these challenging questions on test day. So if you got it wrong today, don't worry about it. We're here to learn together so you can get it right on test day. And if you pay attention to Paris, you surely will. Paris.
Thank you, Sean. Yes, definitely a tough question here. But let's go ahead and talk about it. So in patients who take clozapine, one of the side effects is hypersalivation, which is why they tell us he's been making more saliva lately, and probably why he's starting to get pain in those areas, in the areas of his salivary glands. So on the next slide, Sean has actually gone ahead and pulled up some important figures from first aid, okay? So you can see here we have the ductal acini and the acinar cells that secrete these into what ends up being saliva, okay? So saliva starts off as being primarily isotonic, and you can see there that as the saliva travels out of that into the saliva through the excretory ducts, the excretory ducts and the intercalated cells, they reabsorb sodium and chloride. Okay, you can see sodium leaving that duct and chloride as well. In reverse, it's secreting potassium and bicarbonate. So it's reabsorbing sodium and chloride, and it's secreting potassium and bicarbonate. At normal salivary flow rates, saliva in the mouth tends to be hypotonic, and you can see that the saliva that's leaving that duct, it says hypotonic saliva, okay? In contrast, at higher rates of salivary flow, saliva has less time in contact with those cells, okay? So you have less reabsorption of sodium and chloride, and you have less secretion as a result of potassium. So because the saliva is not as spending as much time in contact with the cells in the duct, because the salivary flow is increased, you have less reabsorption of sodium and chloride and less secretion into of potassium, okay? Thus, the salivary sodium and chloride increase and the potassium slightly decreases as the flow of saliva increases. And you can actually see that on that graph, that is the flow of saliva increases, sodium concentration of the saliva increases, chloride concentration of the saliva increases, and potassium slowly is decreasing over time, okay? Bicarb secretion actually is pretty independent, and so it actually kind of stays the same after a certain point, okay? So the potassium, it may be a little hard to see, but it actually is slowly decreasing over time, okay? So that's why when we go back to this question and we go back to what the lead-in is asking us, so if the salivary flow rate is increased, what substance will be decreased if you compare it with before taking clozapine? And as we just mentioned, potassium is the one thing that decreases with increased salivary flow rate. So that would be the best answer choice here. We talked about how answer choice E and C, sodium and chloride, would actually be increased. Answer choice B, bicarbonate, is actually kind of acts independently, and as that graph showed, it actually increases as well with increased salivary flow rate, so that would be incorrect. And then answer choice A, if you have increased salivary flow rate, you would have a higher concentration of amylase within the saliva, so the best answer choice here is answer choice D.
Excellent. Thank you, Paros. That was definitely a challenging question. And hopefully that explanation helped you and you'll get it right on test day. You know, we talked about RX Coach earlier. RX Coach is our tutoring and coaching initiative, and we've helped hundreds and hundreds of students through it accomplish their goals. As you can see, we have a 4.9 out of 5 student satisfaction. It's pretty hard to beat that, right? And the reason for that, I think, is because A, we have a team that's very experienced, right? I mean, there aren't many tutoring companies out there, or any that I know of, that have actually authored their own medical education resources, such as question banks, flashcards, express videos, now even audio bricks and bricks. So with all that experience comes a lot of data, and with that data comes the ability to create a program that's going to be successful by taking that data-driven and progress-based approach. With a team that's been in medical education for over 30 years, we've gone out and hired the best of the best, and you met some of our coaches today, Faris and Abraham. So instead of a regular USMLE course, which is a cookie cutter approach, which is what everybody does the same thing at the same time, what the problem with those programs oftentimes is that they don't take the individuality of each student into consideration, right? Each student learns differently, thinks differently, has different strengths, has different weaknesses. So by focusing on the individual and analyzing your strengths and weaknesses, we can come up with a personalized study plan that is going to be more efficient and help you get to where you want to be in less time, but also it'll help you get even a higher score. So whether you're in your first semester, your second semester, your third, or your fourth, or you've already graduated, if you want to do better in medical school or on your exams or on your comp, reach out to us, because we have a proven track record of success with the most experienced team in medical education, and our results really do speak for themselves. So if you want to learn more about our coaching program, please visit us online at rx-coach or rx-coach.com. Every coaching program, if you're studying for comp or for STEP or for COMLEX, will begin with a 160 question assessment. Once again, something unique to our company. We've actually authored our own assessments. And so we'll use that to get a baseline of your strengths and weaknesses, make that personalized study plan, and work with you one-on-one to see what are your knowledge gaps, what are your content weaknesses, what are your test taking skills like, and work with you individually to help you accomplish your goals. Once again, that's rx-coach.com. You can click on the free consultation tab and you'll actually have a conversation with me about the coaching program and how it can benefit you. So once again, if you're interested in coaching, feel free to set up that consultation to discuss the program. If you want some general advice, I'll share a link with you later, or you can go online and get some tips for our wonderful authors. And that website for you to know is firstaidteam.com. But don't worry, we'll share the link in the chat and I'll share it with you again at the end of tonight's session. Once again, the answer choices are covered up and we will begin with the lead-in. Which of the following set of findings is most likely present in this patient? Which of the following set of findings is most likely present in this patient? I'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require. All right, I see the responses coming in. Let's take a look at that vignette. A 46-year-old woman comes to her physician because she always feels thirsty despite drinking large volumes of water, is urinating more often and in greater volume, and has dizziness upon standing. She has bipolar disorder and says she occasionally doubles her medication when she thinks she is entering a depressive phase. Which of the following set of findings is most likely present in this patient? Please start looking at the relevant clues in this vignette as I hand it off to Paris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. So starting off with the vignette, again, demographics. So now we have a mid-40s-year-old female, and she's coming in with certain signs and symptoms of being thirsty, urinating a lot, dizziness upon standing. They tell us she has bipolar disorder, and again, another clue about how she's taking her medication. Always important to start thinking about that, okay? Now, looking at the lead-in, they're going to ask us the set of findings most likely present in this patient. So, kind of depends on what answer choices were given here for defining set of findings, but I think probably what's going to happen is, we're going to have to figure out what's going on in this patient, what's the diagnosis, what's the condition, and then two, based off that, come up with the right set of findings, whatever these findings are going to be. So at least a two-step question. We'll see if they add
I think we lost Boris for a moment there. So I'll go ahead and unveil the answer choices while we wait on him to join us again.
I think I may have cut out there. So we have 5 answers. Answer choice E, hyponatremia, low urine sodium, and low urine osmolality. D, hyponatremia, high urine sodium, and high urine osmolality. C, hypernatremia, low urine sodium, and low urine osmolality. B, hypernatremia, low urine sodium, and high urine osmolality. And A, hypernatremia, high urine sodium, and high urine osmolality. So make sure you're looking at hypo, hyper, high, low sodium, high, low urine osmolality.
So we've gone ahead and opened up that poll for you.
Finding osmolality, keeping in mind that these are asking for urine. So we'll go ahead and open patient. We'll talk in just a few seconds.
All right, we'll give all of you a few more seconds here to respond. Sorry about the little tech difficulties there with Boris. He will try to resolve them now, and there's some incremental weather there, which may be causing it. So we'll give all of you a few more seconds here for our third question of the evening, and then we'll move on to question number 4. All right, let's take a look and see what you selected. And it looks like there was a clear favorite, and 42% of you selected answer choice C, which is hypernatremia, low urine sodium, and low urine osmolality. Let's see what the correct answer is. And the correct answer is indeed C, and 42% of you got it right. So with that, let me hand it off to Paris so we can explain it to you. Paris.
Thank you, Sean. So once again, we'll kind of go ahead and walk through this question here. So this patient is taking medication for bipolar disease and now presents with polydipsia, drinking a lot of water, polyuria, peeing a lot, and orthostasis, or dizziness upon standing. Together, this suggests that this patient's having a side effect, specifically due to lithium, probably taking lithium for her bipolar disorder. And specifically, the side effect would be nephrogenic diabetes insipidus, okay? Nephrogenic diabetes insipidus is where the collecting duct is unresponsive to antidiuretic hormone, or ADH. This can be caused by lithium as well as other chronic kidney diseases. Specifically, in lithium, about 20% of those patients can develop nephrogenic diabetes insipidus. So what happens in that condition? Well, first, let's take a look at the next slide. Sean has gone ahead and pulled up a table on lithium, and you can see there under adverse effects, it can cause nephrogenic diabetes insipidus, okay? As well as those other important side effects to keep in mind. Let's take a look at the next slide now as well. And Sean has gone ahead and pulled a table looking at polydipsia as well as diabetes insipidus. You can see there under nephrogenic diabetes insipidus that it's due to ADH resistance, okay? So what happens is you basically are losing a lot of free water, and you're losing this in urine. So you're having dilute urine. So you get volume depletion. So the kidney tries to retain sodium and can develop hypernatremia, okay? Because it's trying to replace a lot of that water that's being lost. So this means the patient would have hypernatremia because of increased reabsorption of sodium. They would have low urine sodium because they're, again, reabsorbing it from the urine into the blood. And low urine osmolality, one, because you're reabsorbing more sodium from the urine, and two, you're excreting a lot of water into that urine. And you can see there under nephrogenic DI that it says slight increase in urine osmolality is possible, okay? So let's go back to our question and the other answer choices, and hopefully you can see thus why answer choice C is the best answer, okay? Now, taking a look at the other answer choices, so hyponatremia and low urine sodium and osmolality, that would be seen in primary polydipsia, which is not what this patient has. Primary polydipsia is excessive water intake, usually due to a psychiatric illness, and not what's going on here in this case. We know that she doubled her medication, so this is most likely a medication side effect. Answer choice D, hyponatremia, high urine sodium and osmolality, that would be seen in the setting of inappropriate secretion of ADH or SIADH. Answer choice B, hypernatremia, low urine sodium and high urine osmolality, that would characterize free water losses by non-kidney mechanisms, not what we have going on here. And lastly, answer choice A, hypernatremia, high urine sodium and osmolality, that would be seen in a patient who's eating or taking in a lot of salt, not what's going on here. So this is a good question of figuring out what side effect is this patient developing, but first needing to know what is that possible medication that's causing it. So a few steps here to this question. So great job to those of you who got this right, and hopefully this is another good learning point.
Excellent. Thank you, Paris. Great job, everyone. We have one question left, so let's try to finish strong. But before we do that, I do want to share with you something. So as Jeff has pointed out in several other question labs in the past, the authors at QMAX and the entire team, they're really passionate about helping students, and they want you to do really well. And as a result, they want to make sure that you have the best resources available. So they have been updating QMAX and making sure that they're putting their best foot forward to help set you up for success. And one of the things that we've done recently is add or change the format of our question explanation. So as you can see here, this is the explanation for the question we just did. So we break it down into steps. This was a 2-step question. The first step was disease diagnosis. The second step was disease mechanism. As you can see here, we've got the explanation like Barbara's explained to you, but just one that you can read on your own. So when you're doing these questions, you can actually have that organized thought process as you're learning to see which step are you making mistakes at. I think this is going to be a very, very valuable tool, and I, for one, was very excited when I saw it, so I hope all of you are too. And Jeff will touch more on this later and tell you more about some of the things that the wonderful team members here at ScholarRx and USMLE-Rx are doing. But I did want to preface his conversation by showing you this because it is the explanation for the question we just did. So if you have any thoughts on this, please let us know in the question box what you think about this new explanation format. And we hope that all of you who have QMAX will love it as much as we do. And for those of you who don't have QMAX yet, we hope that you'll sign up for the free trial and experience what has helped so many physicians get to where they are today. And that is, of course, our resources, which have been created over the last 3 decades. So with that, let's go ahead and get into our last question of the evening. Let's try to finish strong. Once again, the answer choices are covered up. We'll begin with the lead-in. Which of the following urinary findings is most likely to develop in this patient? I'll give you a few seconds here to respond and let us know how many steps you believe this will require to answer. We have people saying, love the new format, love it. This new update sounds amazing. This is really nice, simply amazing. So a lot of positive feedback here. So we're glad that you are as excited and enthusiastic as the team is that is bringing all of this to you. Let's go ahead and read that vignette, which is rather short. A 40-year-old man is diagnosed with bipolar disorder and is prescribed lithium. Which of the following urinary findings is most likely to develop in this patient? I'll give all of you a few seconds here as I hand it off to Paras.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this lead-in and the vignette. And so you can see here a very short question. So in this, again, demographics, 40-year-old male diagnosed with bipolar disorder and prescribed lithium, again, just like the last patient. And again, they're asking us about urinary findings most likely to develop. So again, hopefully, us walking through these vignettes and lead-ins and telling you what we think are the important clues in that vignette and the lead-in, hopefully you guys are starting to get a sense of what are important things to highlight and what are maybe not as important. So when you go back and reread the question, you really have highlighted what's relevant and not have highlighted what's not. And then also figuring out exactly what is important in that lead-in, what are they trying to ask you, what are they getting at, so you can get that question right. So, which urinary finding is most likely to develop? Well, let's take a look at those answer choices. We've got 5 answer choices here. We've got E, urine specific gravity of 1.002, D, urine osmolality of 550 milliosmoles per kilogram, C, urine eosinophils, B, polyuria relieved by giving arginine vasopressin, and A, hematuria. So once again, we'll go ahead and open up the poll. Go ahead and select the finding that you think is most likely to develop in this patient, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paras. So this is our last question of the evening. I see almost 300 people in attendance today. We're happy to have all of you. Make sure you stick around until the very end because like I said before, this is our 1-year anniversary. We do have a very special raffle. 3 winners will win access to RX 360 Plus for 6 months, and our grand prize winner will win RX 360 Plus for 12 months, as well as 3 free RX coaching sessions. I saw a question which was asking, is 4 questions the max per session? 4 questions is the max for question lab. However, not in tutoring sessions. When it's one-on-one, it tends to go a little bit faster. So we'll do as many as we can. Oftentimes our students will do 10 or so, but it really depends on the pace at which you're going, okay? All right, I see the responses coming in. We'll give you a few more seconds here before we move on to our special offer and the raffle. All right, let's take a look and see what you selected. Looks like 42% of you selected E, urine specific gravity of 1.002. And in second place with 35% of you selecting was answer choice B, polyuria relieved by giving arginine vasopressin. The correct answer is E, urine specific gravity of 1.002. Once again, 42% of you got it right, so great job, everyone. Let me hand it over to Paris.
Thank you, Sean. Yes, great job, guys. This is answer choice E. So, as we talked about with lithium, patients can develop nephrogenic diabetes insipidus, as again, kind of like ADH resistance. So, patients will be excreting a lot of free water into their urine, so you will have very dilute urine, okay? So, a urine-specific gravity of close to 1 is telling you that it's very dilute. So that's probably the best answer choice here, and that would be correct. So in the other answer choices, let's take a look at those. Answer choice D, urine osmolality of 550 milliosmoles per kilogram. That's actually a very concentrated urine osmolality. So that would not be what you'd expect to see in this patient. That would be something you would see in SIADH or a patient who's volume depleted. In our case, we know that there's going to be a lot of water going into the urine, so your urine osmolality would be much lower. Answer choice C, urine eosinophils. This is something that you would see. Hopefully you guys remember this is allergic interstitial nephritis, okay? So not what we have going on of nephrogenic diabetes insipidus. We'll come back to answer choice B in just a second. Answer choice A, hematuria. Obviously, you can see that in a lot of things, structural abnormalities, kidney stones, renal structural diseases, and medications as well. Now what we have going on here, and I think answer choice B, which is the second most highly selected answer, polyuria is something you can see in patients who have nephrogenic diabetes insipidus. However, in nephrogenic DI, it would not be relieved by giving arginine vasopressin. If it were, that would be seen in central diabetes insipidus. And actually, Sean, if there's a way to go back at all, a few slides to that same table, we can see here in that table of central diabetes insipidus versus nephrogenic diabetes insipidus, you can see there that in looking at desmopressin administration, you can see with central DI that there is a significant increase in urine osmolality because of efficacy in that versus minimal change with nephrogenic DI. So depending on if it's nephrogenic diabetes insipidus or central diabetes insipidus, which as you can see there are much different causes, okay? So it's important to keep in mind what was causing the diabetes insipidus. In our case, it was lithium, so we should be going down the nephrogenic DI pathway. So this would not be responsive to arginine vasopressin release, and thus kind of a tricky answer choice that they're giving you there. So answer choice E, or a low urine specific gravity of the urine, is the best answer there. And hopefully you guys were able to learn a few things today in this Q Lab about psychiatry, and I will pass it back to you, Sean.